Hi there, my name is Peter Taras and I'm here with my friend Brendan, and we're going to be talking about healthcare in Ontario. Right now, especially in the Niagara region where they've built a new hospital, there's a lot of talk in Fort Erie about closing the hospital. There's been continuous efforts to save that hospital, and yet the only real answer is throw money at it. Because we have a situation where government has a monopoly on healthcare, and last time I checked, no matter what industry it is, if there is a monopoly, it never results in better service for the end user, never ends up with more innovation, never ends with more resourcefulness of resources. Brendan, we're going to just have an open-ended discussion. I think it's going to be more philosophical in nature than specifics. Mm-hmm. But what do you think about just our current issues with healthcare in Ontario?
I wanted to start with getting a little perspective on healthcare, and to do that I just came back from China, and in China they have a very different healthcare system there. It's not a socialized healthcare, it's private healthcare. But what ends up happening in their healthcare system is somebody will get sick in the family and the entire family will dump everything they own into the healthcare system to make this person well, and then more often than not, when someone's really ill, they end up dying, passing away. And what it ends up doing is draining the entire family of their resources, and then they do very, very poorly after that. And I know the healthcare system is very different, but the decision at that point in time is an emotional decision that's made, and it's not made in regard with any other considerations. And because of that, it's actually a good thing that it's not a socialized healthcare system, because if everybody could do that, it would be several times all of their incomes, and then there would be no way to survive. And
I think in our situation here in Ontario, the argument would be made that our incomes are much higher, our tax base is much greater, because we have a lot more income, so we can afford to make those kind of emotional decisions that might be very costly, but it's worthwhile in a lot of cases. That's the argument that could be made.
It's a lot of money that we're talking about. Mm-hmm. A lot of our income tax goes into healthcare, and the decisions that are being made, if the person ultimately doesn't end up surviving, I mean, if you don't end up reaping any benefits from that healthcare itself, then what are you left with? So I think the point that I was trying to make is that there needs to be a social impulse to decide what we want out of healthcare, rather than just having healthcare. So if we don't come together and decide what we really want out of it, if the decisions aren't made with a clear head at some point in time, then healthcare itself takes over. And this in turn, it breeds corruption within the healthcare system. It tends towards materialism. Health sciences are very materialistic, which in many ways is against a lot of the personal values of society. Maybe not everybody, but certainly in terms of myself.
Yeah, me too. I try to be resourceful wherever I can be.
I don't appreciate that.
No.
And so there's this pull towards healthcare taking over things, and the more power we give it by not putting our own intentions and wishes into it, the more it takes over. And it takes over our freedoms too. For example, during COVID, we had a societal obligation to become vaccinated. And one of the reasons why that was a societal obligation is because it was free. If we had to pay for our vaccine, we would have been able to maintain our own autonomy, because it's respected in this society that you can say, I don't want to pay for that. But it's not respected in our society that you say, I don't want to do that to myself.
Yeah, and I think it's very interesting too that if you even question the healthcare system and say, well, should we really, if it's a government service, shouldn't someone be allowed to compete against this government service as a minimum, maybe just as an idea, to make sure to keep the government system in check. Because when the government goes without any checks or balances, and nobody is there to put a counterbalance to the whole system, then I think they will just go asking for more money, because that is the only option they have. When you have the unions who are running it, all they know is more money. All the governments know is giving more money. But when governments say, well, listen, we're going to try to create, there's an example. There's a hospital in Thornhill. It's a hospital that does just hernia operations.
Okay.
And they're very good. It's a private hospital. It started off as a private hospital. The government has allowed them to keep their private status and continue to earn money. The doctor that started it was a specialist at this. They are the most efficient at doing hernia operations. The government system sends them there. I could envision a situation like that for, let's say, broken arms, broken legs, or a very specialized kind of hospital that someone could set up privately, that the government can still pay for, but at least there's competition. There's a press or a push to try to save money and make things better for the end user, and also make things better for the taxpayer.
So one of the problems that happens in our socialized system is that people, because it's free, people will go to it for anything.
Yeah.
They go they go to it for all kinds of things, which means that the government then in turn has to try to limit the amount of money they're spending, and so they place a lot of restrictions. And one of those restrictions is that a family doctor can.
There's no restrictions on MAID right now.
Yeah.
You can get MAID within 1 day. You can get MAID.
Yeah,
so
but
no restrictions there, Brendan. So I have to correct you there.
Getting rid of the unhealthy people, I mean, is probably a plus in their pocketbook and on their spreadsheet. But the general practitioner can bill for 30 minutes on your first visit, and then is only able to bill for 15 minutes on every other visit. And so if you want to go to the doctor, you've got some problem, you want to explain it to him. Yeah. Because people are flooding the healthcare system, they have to restrict things, which then means you don't have the time with your doctor that you need. But if we were to do something like you pay for 1% of your visit, you go in, you might have to pay $10. It would have, or whatever the figure is, most of it'll be covered, but then you have to go, is this worth that 1%?
That's a great idea, because then there's a buy-in from everybody who's going to be, you won't waste the system. Because it's only, even if it's such a minuscule amount that you're paying, you won't waste it because it's your own money. So that is a really, I think that's a really good idea. Or alternatively, you offer options to people where they can go to private healthcare, but it's still paid for by the government.
Absolutely.
And then the private could charge you, let's say you have to pay $50 for a visit or get an MRI the same day rather than waiting 3 months. Then it gives you that option to pay the $50 because they tell you it's free healthcare, but you have no option except wait 40 weeks for a hip replacement. What kind of option is that?
In our taxes right now, we are required to pay for, we're here in Ontario, we are required to pay for OHIP. But OHIP is an insurance company that does not change your premium. You pay the same amount depending on how much you use healthcare on your taxes. It does not, your taxes don't go up or down depending on how much you use the healthcare system. We don't do that with cars. When we get car insurance, you get into accidents, it goes up. So that would be a counterbalance. But if you could select, if the government said, okay, we're going to pay this amount for healthcare, and you can select a plan, you can select which insurance company you want to cover you on your taxes.
So you can choose the Ontario, for example, the public health care A, public health care B, public health care C.
Private health care C.
Or private.
Or like if, another province has a healthcare system who wants to get into the Ontario market, then they can move over, and then you can start kind of deciding where you want your money, and you might be able to, you might get a little bit of coverage in one area but not another area.
Well, I'm going to give you a response that you'd probably hear if you suggested something like that. Yeah, but the Americans have that, and look at the American system. The American system is so bad. That's what I always hear when I try to bring up something that, you know, maybe tweaks our system a little bit to make it more, not like the American system, but to make it like our system that works. But they'll always say, we don't want the American system here. And so that's why people are not interested in even listening to ideas, because what they see in the United States as, if we change anything with our system, we become more like the United States. And I don't think we need to think of it or frame it in that way at all.
I mean, I'm not sure I hear what you're saying. I'm not sure it's a great argument because they don't have socialized healthcare in the U.S. I mean,
They do have
a
Medicaid.
little bit, but not really like we have here. But in addition to that, I think one of the roots of this problem is that healthcare is used in Ontario. One of the reasons why I think that people don't want to address this issue is that healthcare is used as a way to put your health responsibility onto somebody else. You can go to a doctor, he can tell you whether you're fine or not, he can make the decisions for you, and people want that healthcare system there so they don't have to have the conversation of where they want to draw these lines. So right now the lines are being drawn. We are just not drawing those lines. The lines are being drawn for us.
Mm-hmm.
And if we really want to move forward in a way that it benefits us, we need to take control over where we want those lines to be drawn rather than following what's handed down to us.
Yeah, and those conversations could be awkward because whenever you start talking about money, people don't. It's always a little bit gauche to talk about money to, let's say, heal your arm or heal your body. It's always a little bit gauche, but it's a reality that we must face and we should be doing it. And when you talked about personal responsibility, is there a responsibility to government for your health care? I believe ultimately it's 99% the individual's responsibility for healthcare and their family if they're a minor or if they're elderly. It's very little responsibility, I believe, on the government because the government is nameless, faceless. They have no interest in keeping you alive, as we're finding out now with MAID. They have no interest in keeping you alive because you're a liability if you're alive. They want you healthy, but if you're sick, you now be. So this is no longer health care anymore. This is survival care.
And that's what I was about to say. It's not healthcare. And you can see that very clearly because when we think about healthcare and the way we're talking about healthcare, we're talking about our health, our bodily health. But the standards of practice in medicine is not about health. It's about following the standards of practice. And so if a doctor does an unconventional treatment, which really helps somebody, which makes somebody better, he'll be reported by other doctors for not following his standards of practice, and he could lose his license or be suspended.
Unbelievable. And I know a situation of that where a doctor cured someone and he was reprimanded for curing someone. And this is obscene, this is perverse, that we have this, we go to our doctors because we want them to use their judgment. But as soon as they become doctors, they have zero judgment available to them because all they can use is the acceptable standards of care that the drug companies give to them. And is it any surprise that the doctors act in this way or treat this way is because every single medical school in North America has its biggest benefactor as Big Pharma. So it's of no surprise the way these doctors practice medicine.
And that's really important because in having a conversation like this, we can then realize that when we say healthcare, we're talking about one thing, but when we go to the hospitals, they're practicing another thing. Yeah. They're not there to make people better. They follow their standards of practice, and when people get better based on something else, they become unhappy.
Yeah.
And so as individuals, we think about healthcare as in us getting better, us being able to maintain healthy bodies, etc.
Yes.
But if we don't have this conversation, we can never come to the place where we end up achieving that, where we end up getting that.
Yeah, I think you're right, and I think we have to continue to talk about these things. And I think, you know what, Brendan, I think this might be a good spot to end this conversation for our first conversation. And maybe in the future we'll have another conversation, and we'll really focus in on some of these issues that are really plaguing our healthcare and actually making, I think, our population sicker rather than healthier.
Good. Well,
Do
Peter,
you have
thank you for having me.
any final thoughts on this idea?
I think that's it. Thank you for having me.
Thanks so much.
Take care.
Take care, guys.